Meningitis is one of the diseases that the government, through the Ministry of Health, has ordered for immunization to young children in order to reduce infant infections. But as it emerges, little is known about the disease, which at times is confused with malaria and can be fatal. Our reporter Sam GITUKU spoke to a pediatrician and visited a child admitted at the Machakos Level 5 hospital after contracting the disease. Traditionally, meningitis is known to result from viral and bacterial infections through the respiratory system, where the tissue covering the brain or the spinal cord gets inflamed, exposing the central nervous system to complications. Dr. Tunja talks of main symptoms of the disease.
Symptoms include irritability, onset of fever, which most of the time is high-grade fever, restlessness, and sometimes inability to feed. And especially for a newborn baby, if they refuse to breastfeed and they're having high fever, that may be a pointer towards infection. For older children, in addition to fever, headache, or stiff neck, or just neck pain, sometimes loss of consciousness.
Dr. Tunja's sentiments are confirmed by Andinda, mother to baby Evelyn, a 3-year-old child who has been taken of the disease.
Mtoto alilala kutoka saa 8 mpaka saa 12 hivi. Sasa vile niliona tu kama amelala sana, nikamwamsha, nikampatia uji, akalala tena. Asubuhi nikamwamsha tena, ndio shingo ikakua hivi, akatoa ulimi. Mimi nilikuwa nafikiria ni malaria ile kubwa.
Baby Evelyn is responding positively to medication and she can now walk and speak again. Dr. Tunja says bacterial meningitis is more serious and may lead to death if not treated early, a fact that has required the disease to be treated as an emergency where antibiotics are administered immediately. She warns of lifetime complications if the disease is not diagnosed and treated early.
The major one is a mental dysfunction, where you find this child becomes slow in growth, visual problems, hearing, and then some of them may actually develop convulsions later after suffering meningitis. So they have to be on long-term treatment for convulsions. Other rare complications would be difficulty walking, because some of them may come with paralysis.
However, the disease is preventable if mothers observe hygiene, avoid overcrowding, and above all, take their children for vaccination in government hospitals at the ages of 6, 10, and 14 weeks from birth, which is free. Reporting for this station, I am Sam GITUKU.